Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with Organization for a Safer Space. Today, I will be talking about oppositional defiant disorder. In this video, we'll first look at what oppositional defiant disorder is. We'll then look at some statistics, risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. It is normal for children to be oppositional every now and then, especially when they are tired, upset, stressed, or hungry. They may talk back, argue, and disobey parents and other adults. It is a normal part of development in the early years. However, hostile and uncooperative behaviors can be concerning when they occur consistently, differ from other children their age, and affect their school and family life. Oppositional defiant disorder is a type of disruptive behavior disorder that is characterized by patterns of irritable mood, argumentative or defiant behavior, and vindictiveness. There are two types of oppositional defiant disorder: childhood onset, which begins from an early age, and adolescent onset, which begins between the middle school and high school years. Most people with oppositional defiant disorder have at least one of the following mental health conditions: attention deficit hyperactivity disorder, or ADHD, mood disorders, anxiety disorders, and impulse control disorders. Statistics. It is estimated that 2% to 11% of children have oppositional defiant disorder. Around 30% of children with oppositional defiant disorder develop conduct disorder, which is a condition characterized by frequent aggression toward other people. Around 40% of children with ADHD have oppositional defiant disorder or another conduct disorder. Risk factors. Oppositional defiant disorder affects children and teenagers, but it can also affect adults. It typically begins by the age of 8 and affects more male than female children. There are biological and environmental factors that increase the risk of developing this disorder. The biological factors include a family history of ADHD, oppositional defiant disorder, or conduct disorder, a family history of mood disorder, a parent with a substance use disorder, a mother who smoked during pregnancy, unusual levels of neurotransmitters, and damage in parts of the brain involved in judgment, reasoning, and impulse control. Environmental factors include neglect or abuse, family instability, such as a divorce or moving homes often, harsh or permissive parents, inconsistent discipline, rejection from others, a chaotic and stressful home environment, and living in poverty. Symptoms. The symptoms fall under 3 behavior categories: anger and irritability, argumentative and defiant behavior, and vindictiveness. The anger and irritability behaviors include frequent temper tantrums, anger and resentment, being touchy or easily annoyed by other people, and frequent acts of disrespect. The argumentative and defiant behaviors include frequent arguments with adults or authority figures, refusal or defiance to comply with adult requests or rules, attempts to annoy other people, and blaming others for one's own mistakes. The vindictiveness behaviors include spiteful attitude and revenge seeking, and mean and hateful talk when upset or angry. Effects. If left untreated, oppositional defiant disorder can negatively impact social relationships, family life, school performance, school behaviors, work performance. It can also lead to substance use disorders and a higher risk of suicide. Treatment. The treatment for oppositional defiant disorder can involve a combination of the following: parent management training, psychotherapy, and school-based interventions. Parent management training is the most frequently used treatment for oppositional defiant disorder. It teaches parents or caregivers behavior management strategies with the use of positive reinforcements to reduce misbehavior at home. Psychotherapy. This can include cognitive behavioral therapy. This type of therapy can help people understand how their thoughts and emotions affect their actions and learn positive thinking patterns and habits. Cognitive behavioral therapy can help a person with oppositional defiant disorder learn how to better problem solve and control anger. Another type of therapy is family therapy, which helps to improve communication and interactions between family members. Lastly, school-based interventions. These help to improve school performance, friendships, and problem-solving skills. The interventions can involve education and tools in the classroom to improve behaviors, techniques to help avoid oppositional behavior, and help a child follow the rules. Coping strategies. There are several ways to cope with oppositional defiant disorder, such as building on the positives by praising a child and using positive reinforcements, taking a time out when tensions rise with a child to avoid them from overreacting, setting reasonable limits and consistently enforcing consequences, maintaining a child's interests to allow time and energy for oneself, and trying to obtain support from others, such as friends, families, or teachers. Feel free to check out the Organization for a Safer Space at forsaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.